Go.
Hi, this is Dr. Nourparvar with one of our patients, Dr. D. For privacy, she didn't want to be in the video, but we thought it was important to share her experience with the stem cell treatment here for different problems she had, and she had really good results. She got IV stem cell treatment for actually helped her with 3 different problems she had. One was, I believe, interstitial cystitis that she's been having for many years, and ulcerative colitis, and also her eyes for vision for retinopathy, right? Because actually she can probably tell you more. She actually has a PhD, and she's in the scientific field, and she can tell you a little bit more about her experience, how it changed her life. So maybe I'll just maybe ask you, I guess. So how many years did you have the interstitial cystitis for? How much was bothering you?
It was diagnosed 13 years ago, but I think I had it for several years before that, undiagnosed.
I was undiagnosed, and then you said it felt like I think you were just telling me felt like
felt like glass in my bladder, constantly scraping, and it was quite unbearable.
Right, I know your doctor said there was no cure, I believe.
No cure. And the one medication that was designed for it, I had to go off of because it was creating problems with my retina.
Problem for you, right? That's how the problem with the retina started.
Yes.
Right, and then that caused the retinopathy, I believe. And,
yes.
And your vision went down to, I think it was 150, 20 over 150?
Yes.
20 over 150.
Right, which was quite worrying, but I couldn't go back on medicine. And I mean, they said I would go blind, but that created more intense problems with the bladder. So I researched this, and I am so glad that I did, because this is my 3rd session, and I started feeling it with the first, the second, and now I'm just looking for long-term remission.
Right, and then, so the bladder symptoms you said went away?
Yes, and the colon too, actually, that started faster, so. But that's also wonderful.
So what were you experiencing with the colon?
I could not hold any food down. At one point, I was down to like 89 pounds.
Wow. Was it nausea, you think?
Well, I just couldn't retain anything.
Diarrhea?
Yeah, like 10 times a day.
Did you go to the bathroom 10 times a day?
Yeah, easily. And it was almost impossible to ever leave my house under these circumstances.
And then now
I'm and I'm finally at a normal weight for the first time in also 13 years.
13 years, so
yeah.
This is the best you said. I think it's the best you felt in 13 years.
Absolutely.
Right, so now that you can tolerate the food better now, and do you get diarrheas or nausea?
Not at all.
No. All is gone.
Yeah.
That's good. And then the bladder, you said the pain is completely gone. It doesn't, right. And then the eye, and then that was a thing that was very impressive. I think you're ophthalmologist. How was his reaction?
Oh, thrilled. The bad eye was at 20 over 50, and my right eye, which was at 20 over 50, is now at 20 over 30. So.
One was 150, I believe?
Yes.
20 over 150 went to 20 over 50, right?
Yes.
And then the other also was 20 over 150?
No, that was like 20 over 60.
20 over 60, now went to
20, 30.
20 over 30.
You know, is really wonderful.
Right. And I think you said you felt your ophthalmologist was shocked, right?
Yes.
Yeah. Very good. And then, so most of it you felt after the first treatment, and then the second treatment of your eye, I think, started changing, right?
Exactly.
Right. Well, the first one was the colon and the bladder too, after the first
Yes, I started feeling it was better. But now I feel normal.
Right, okay, great. And then we did some drops too for the eyes, right? We did some PRP drops.
Absolutely.
Right, great. Anything else you want to say?
Thank you.
All right, thank you.